I'd like to get started if we could. My name's Kevin Farrell. I'm the Executive Director of the Center for HIV Identification, Prevention, and Treatment Services at UCLA. It's a consortium of UCLA, Charles Drew University, Friends Research Institute, and the RAND Corporation. And we'd like to welcome you today to Substance Use, Mental Health, and HIV, Integrating Treatment as Prevention. And this is the fifth in a series of 5 conferences we've done over the last 5 years concerning biomedical interventions for HIV. I have a couple of little housekeeping things before we get started. One is we're doing a video blog of this. Well, we're filming everything here at the conference. I think all of you would have signed waivers. If you didn't, there's a chance to do so downstairs. If you don't want to have the opportunity to be filmed or to be seen up here, you probably want to sit over that way a little bit because that part will not be filmed. That part of the room won't be filmed. So we're also doing a video blog. We're trying this for the first time. It'll go up on our website and our Facebook page. All the addresses are right there. There's a cube downstairs that is draped where you walked in. And in there, we're going to ask you, each person that goes in, to talk for 90 seconds or less about what HIV treatment as prevention means to you. You can make it a personal statement, a professional, however you'd like to frame it, and that will all appear in edited form on our blog. I'd also like to let you know that the ladies' room and the men's room are right outside the room, the main entrance here. The women's is to the right, and the men's is to the left. There's a break at 9:45. All the coffee and juices and everything will be replenished then. We have lunch right at noon. We'll go for only an hour for lunch because we'd like to get started right again at 1 o'clock. I'd ask you all if you could observe that. We'd appreciate it. And then we'll get through the afternoon till 3:30. We want to definitely end at 3:30 so that people can get over to the National HIV Prevention Conference and get signed up, registered, or whatever you need to do. So without further ado, I'd like to introduce the Director of CHIPTS, Dr. Mary Jane Rotheram.
Thank you very much, and we really appreciate you coming out on a Sunday morning at 8:30. We figured this reflects how important the last year and a half have been in changing. The research that has come up has totally changed the name of the game in HIV. I started working in HIV in 1987. And at that time, I was at Columbia University, and I remember people going blind with CMV, and then they would become paralyzed, and time to death was, at that time, 11.4 months. New York City kept better records than any other place in the country. And today, and we've had for the next 20 years, we had a series of really bad news. Initial behavioral gains weren't being sustained in long-term studies. My diaphragm didn't work. The first microbicides raised the rate, 9-oxynol-9 raised the rate of transmission. Herpes treatment didn't work. Negative finding after negative finding until 18 months ago. Now we have microbicides as a topical prevention and treatment as prevention. And it actually might happen, I'm told, with the active investment and data that has been obtained by the CDC and all the NIH agencies for rapid, routine, consumer-controlled testing. It might happen, right? Don't you think, Kevin? But that there have been such great breakthroughs. The chronic depression that you saw among researchers and CBOs has really changed. And for those of you who went to Italy, I understand it was a carnival-type atmosphere because people were giddy. The news was so good. The possibilities were so different. But the world has changed. We're in a major recession. Some say maybe on the verge of an economic depression. And in some ways, the miracles that have been touted also have potential downsides. Things that we don't know. Will people adhere? Will there be resistant viral strains that emerge? What are the costs, and how are we going to allocate our resources in a recession? Today is about both sides of this issue, about treatment as prevention and the real opportunities that exist, as well as what are the complexities? What is it going to mean at the state level with our drug formularies? What is it going to mean for our most disenfranchised population? What is it going to mean for men who have sex with men? And in particular, African American and Latino men who have sex with men in this country. These are the issues we want to talk about today. And we thank National Institute of Mental Health, who's been our ongoing partner and primary funder for the last 5 years on this series. We've done HIV testing, circumcision, microbicides. This is the last in that series. And we look today to a new generation of preventive and clinical interventions. And we have the best people in the country, starting off with Dr. Kevin Fenton this morning, but just the cutting edge leaders in substance abuse, mental health, and HIV, ending with Dr. Diffenbeck this afternoon about where National Institute of Allergies and Infectious Disease expects to be. So we want to welcome you, and I'm not going to talk any longer so that we can get to the meat of the day and that we can hear from you. I also encourage each of you to go down and please give us 90 seconds of your time to talk about what treatment is prevention, the consequences for you and your community at the local level, and for us to get you on video, and to give us your, share with us your viewpoints at the end of the day. Welcome, and we hope we have a really productive and good day together. Now I'd like to introduce Dr. Cynthia Grossman from the National Institute of Mental Health, who's in charge of their secondary prevention portfolio, to also welcome you. Cynthia.
Thanks, Mary Jane. I just want to welcome everyone. I'll keep my remarks very brief. The National Institutes of Mental Health has been pleased at the Division of AIDS Research to support this meeting for the last 5 years. And for those of you who've been to previous meetings, Andrew Forsyth was the program officer for that. He has since moved to HHS. But certainly this meeting has kept up with the cutting edge of the science and the fact that, as Mary Jane mentioned, the landscape has changed dramatically. And so these meetings are very important, and we're very happy to be able to support it. So I welcome you. Good morning, and I look forward to a very interesting and productive day.